Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, sitting once again in Newport Beach with Dr. Millicent Ravello.
Good afternoon.
And Millicent, what do you think about our first round of podcasts in Newport Beach? We're kind of rolling now.
Yeah, I'm going with it. I like it. We have a beautiful view. We have a nice weather out there. It's a fun little place to be. I'm digging it.
It's beachy.
I like your Newport Beach.
It's not too bad.
Yeah.
This is where I live, so, I have to have an office here. I can't just, bomb into Beverly Hills all the time. I got to, see some people here. Today we want to talk about something that came up at the Los Angeles Society of Plastic Surgeons. Is that right? LASPS? I had to think it through what that actually stands for.
That's right.
It's the Los Angeles Society of Plastic Surgeons meeting. Recently, we had the president of the California Society of Plastic Surgeons come and speak. That was Dr. Zimmerman from Sacramento, who's a great guy. And we were talking about credentialing, and the reason it came up, and we're going to go through our credentials so that people understand just exactly who we are. And, we've talked about this in the past, but this should be very focused because there was a bill that was defeated in the California State Senate for basically allowing anybody who wanted to do cosmetic surgery.
Well, not even do it, but promote themselves as equivalent
as
to
certified.
A plastic surgeon.
Absolutely. It was insane.
Yeah.
It was crazy.
I'm sorry, what was it?
It was crazy.
So
it was insane. How had this even got that far?
Well, let's take it back a little bit. So let's talk about what our credentials are and how.
Did I mention that it was crazy? Because I'm going to say it again because it was. We sat there and I was like, how did this even get so deep that there was a vote of possibility that this was going to go through?
Well, it's nuts is that it's been voted on multiple times. This issue has actually been brought up across the decades as a thing.
It's crazy. I'm sorry. That's all I can say.
Well, let's back up so that our listeners can understand why it's so crazy. To understand your rage and frustration.
Okay. I'm going to calm down and let's get back to the credentials.
You're in Newport Beach.
That's right. It's so easy.
Take a load off.
That's right. It's so chill. But in the meantime, people were about to get hacked up by any Tom, Dick, or Harry who wanted to pay their $3,000 and get certified. That's really what it came down to. So in our training, what happens is we go through medical school and then we apply to residency, and we do a residency. There's a lot of ways to become a plastic surgeon, but to get certified by the American Board of Medical Specialties, the ABMS Board of Plastic Surgery, which is what we are both certified by, you must complete a residency in plastic surgery that is accredited by the American Board of Plastic Surgery. That means you can do 5 years of general surgery, 3 years of general surgery. You can do an otolaryngology residency and then complete 2 or 3 years of plastic surgery. Or alternatively, which what I did, is I went directly into a combined general surgery and plastic surgery program that was 7 years long. How did you get there?
Or the other way.
Another way.
Another way is an integrated program, which is straight out of medical school.
Straight out of medical school in plastic surgery.
Right into plastic surgery
That's
for
right.
6 years. So those are the ways. You either come right out of medical school, go into a plastic surgery residency, which is 6 years, or more if you do research, etc. Or the older version of that is what you did, which is the combined program,
right,
where you do 3 years or 2 years of general surgery, and then the rest of your residency, 4 or 5 years, is plastics. Or kind of the more old school traditional way, which is the one that I did, which is 5 years of general surgery, got my general surgery board certifications, then went on and did a separate plastic surgery residency for 3 years, and then got my boards in plastic surgery.
So you're double board certified.
So I'm double board certified. And there are some ENTs which do that as well. They do a full 5 years of ENT residency, get their boards in ENT, and then go on and do a plastics as well. So there are several different routes to get to be a plastic surgeon, but all of them involve doing a full plastic surgery residency, and then at the completion of that, going on to get your board certification in plastic surgery. And where it gets confusing, because There are lots of boards out there. There are a ton, and patients and even doctors get confused by what all of these boards mean. But there's one agency, the American Board of Medical Specialties. It is a very comprehensive organization, and within that organization are all of the true, legitimate boards in America.
Right, that are recognized by hospitals,
Yes.
by our insurance companies, by by Medicare. Those boards are seen as the overseeing accreditation boards.
Right. It means you've done the actual training, you've passed the exams, you haven't just paid for board certification in who knows what. So American Board of Medical Specialties encompasses all legitimate boards across the specialties. It's, orthopedics, ENT, family medicine, what have you. They have guaranteed that these boards are legitimate boards that have required
Neurology,
actual training and residencies. And
vascular surgery.
If you have a board certification that is not part of the American Board of Medical Specialties, then chances are it's not a real, I don't want to say not a real board certification, but it hasn't required the rigorous amount of training required by the American Board of Medical Specialties.
Right. And there are also certificates of added qualification or whatever it is, the CAQs, right? That for like hand surgery and craniofacial.
Super specialties.
Right.
Another thing about the American Board of Medical Specialties and the way it regulates the boards under its authority is that it requires the physicians and the surgeons to do continued medical education, or CMEs. To maintain your board certification, you have to continuously show proof that you're going to conferences, that you're taking extra classes, that you're staying up to date with your specialty. And that's part of maintaining your board certification with the American Board of Medical Specialties.
For sure. And that is, that continuing medical education is what we do when we go to conferences and when we, take in-service exams, and when we, read our journals. You can get CMEs for that. But what happened was, and Zimmerman talked about, is that this bill to make the cosmetic surgeons equivalent to us was like this close to passing.
Well, so let's talk about what a cosmetic surgeon is, because I don't think we've defined that either.
Well, you're going to have to tell me, because like last I checked, pretty much it's like a mail away certificate in the back of a comic book or something. I don't know where this even came into being.
It's a little bit more than that, to be fair. So a cosmetic surgeon is someone that's done usually general surgery, but it could be ENT, it could be actually an ophthalmologist who's then done an oculoplastics fellowship. There are a couple different things they've done, and then they've done 1 year of a cosmetic surgery fellowship. They do have to do 1 year of a cosmetic surgery fellowship, and there are accredited cosmetic surgery fellowships out there. 1 year.
Accredited by who?
By
the American Board of Cosmetic
Surgeons. Right. But they do require at least 1 year specialized training in cosmetic surgery, coming out of, general surgery or ENT or what have you. 1 year. 1 year. How long were you in training for?
7, but who's counting?
Yeah.
I mean, I took lungs out of like one body, put them in others during my 3 years of general surgery. I mean, we took split livers from an uncle and put it in a kid under my, this board to me was like, when he went through what it took to do it, I kind of sat there. I was like, how is this even a discussion? Like, if you were to present that to people and like, okay, so you can go to somebody that, did like an ophthalmology residency and then this 1 year of cosmetic surgery fellowship, and now they're going to cut on you. Or do you want these people that did, gunshot wounds to the abdomen, that did burn surgery, that did transplant surgery, that have done, vascular surgery and like fixed the aorta,
Right.
for 3 to 5 years, or an ENT done, big, massive mandibular. Yeah, I mean, the ENT, these are like massive operations. Like
they know that anatomy. We all know the anatomy.
Absolutely.
Whole, inside and out. Because we've been there. We put our hands in there.
Of course. Yeah. So then now they've done, this 1 year cosmetic surgery fellowship, and now they're going to operate on you as though they are equivalent to our training. And it's not safe.
Yeah. And their argument for it is that and actually they will say this, we are specialized in cosmetic surgery and aesthetic surgery, whereas plastic surgeons, they do reconstructive surgery. So they don't get as much specialized training in the aesthetics and the cosmetic world that we get, which is bonkers because not only are we doing reconstructive surgery in our residency, we do decent amount of cosmetic surgery.
Loads.
Just because we know how to take things apart and put it back together from the base doesn't mean that we also don't know how to make it extremely beautiful and better than it was. It's nuts, but that's their argument.
It's not a good argument, and it's not safe. And I sat there with my mouth agape during his presentation, and I was like, how is this not even? I mean.
Well,
it's crazy.
And the whole point of the bill is to hopefully get some transparency amongst how people advertise. Because you can say, that was the whole point of the bill. You cannot say now that you are a board certified cosmetic surgeon. Like, you're not allowed to say that. You can get your boards in cosmetic surgery, but if you advertise that you are a board certified cosmetic surgeon, it actually goes against the law. Like, you're breaking the law.
Right. So that would be something that would get reported to the Consumer Affairs, to the medical board, basically, and they would get dinged.
Because the idea is that you are claiming equivalency.
Yeah. No.
Yeah.
It's not even close.
Yeah. You can say you're a cosmetic surgeon. You can put all your training on your website. You just can't say that you're a board certified cosmetic surgeon.
Yeah. Well, I mean, it's just, to me, I just was, I was blown away. It was kind of like, how is this? I don't know how something gets so far down the pike. And I guess it's somebody's paying for it. I guess it's really, in the end, it's just there's money behind it.
Yeah.
The reality is that, you're sitting there watching this bill go through, and I'm like, how is this even close to correct?
Well, because, the lawmakers, once it was explained to them exactly sort of what we're talking about, most of them were like, okay, well, we get that. That makes sense. But they're lawmakers, they're lawyers, they're businessmen. They're just like everyone else out there who hasn't done a medical residency. They don't know. Because how or why would you know? You read something on someone's webpage and you assume that board certified. That must mean something. So people don't know. That's the problem.
You got to go to the next level.
No. And why would you? Because, how would you know?
Look, when I saw the Kobe Bryant story, God rest his soul, I said, well, the news makes things up. I have to check and see if that's real. Because I didn't believe it. I said, I got to get another way to confirm it. Because, the news, they say whatever they want.
Yeah.
I got a letter from Fox News saying, like, we can write whatever we want. None of it needs to be true.
None of it needs to be true.
Nothing we say needs to be true. First Amendment, anything we say can be made up, false, upside down. It is irrelevant. There's nothing we write that has to be true. I have that letter, and it says it very clearly. So if the news doesn't have to make it true, then why not put board certified in cosmetic surgery? Who cares?
Right.
The patients don't know.
And that's ultimately what it comes down to. It's about patient safety.
Yes,
and
that's the whole point.
That's the whole point. And I don't want to, knock on the cosmetic surgery colleagues because, that's their job and, they did training and they went through residencies as well. But you just have to, as a consumer, know who you're getting and what the difference is between the two.
I get why they want to do it. They want to make more money. It's totally.
Money's money.
Who's going to fault them for that?
It's their job.
Absolutely, they're cosmetic surgeons. They want to get paid. They want to be board certified. Absolutely. I get all that.
Yeah.
That is. I'm not saying that that's a problem, but I think that the public has to know the difference between apples and oranges.
Absolutely. Yeah.
You can't be comparing board certification in plastic surgery to a board certification that's not ABMS, whatever it is. I don't care if it's cosmetic surgery, whatever it is. I want to be, board certified in, pathological, craziness of people.
I'm sure there's a board for that.
There's a board. and I'm not even going to say it, but the reality is that you can't say that that's a ABMS board. It's not, and to advertise it as such is not correct.
And I would like to take it just a little bit further because at least a cosmetic surgeon is a surgeon and they've done some kind of surgery residency, generally speaking. There are people out there who are not even surgeons. They are barely medicine doctors,
totally,
if that, who are going out there and advertising themselves, calling themselves surgeons. And God help me if they're actually doing surgery.
Oh, they are.
But they are advertising themselves as such. So that is why it is, unfortunately, you cannot believe everything you hear or read. You have to